Hello, everybody. We welcome you to today's edition of the Euro Health podcast with the moderator being me, Tomáš Jirsa, and my colleague Honza Klusáček.
Hello.
And who's our today's guest?
Well, today we welcome here Professor Heino Stöver, who is director of Institute for Addiction Research at Frankfurt University of Applied Sciences. Thank you for coming to Prague.
Hello.
Hi.
Good morning.
I cannot start in any different way than by citing not all the topics we have to go through today, which is all prevention, drugs and everything, but start in literature. What is your personal take on the wee kids from the zoo station? Because that was something of a game changer in the Czech Republic when we started growing up in the 90s. And so I'm interested about your perspective as somebody who is professional in the field and is German at the same time. What kind of phenomenon is it? The book.
The book?
Yeah.
The book. You mean a book? Or which book? I didn't get it.
We kids from this Wir Kinder von Bahnhof Zoll.
Sorry, sorry, I didn't get it. This book was very famous in Germany. It is mystifying in a way, the drug scene in Berlin. There was a film about it. It's a little bit tricky, and it's been seen critically. So David Bowie even made a song out of it, or made the film music, I guess, something like that. So it was kind of a big mystification of what's going on. But you're absolutely right. Once I'm in Berlin at the station of the zoo, it still reminds me always once I'm there on the toilets, on the surrounding, it is sort of a symbol of a drug scene in Germany. But you can see a little bit of typical way in many cities. But not in that way, which is, I would say, being mystified in that way that people always use heroin. Most of the drug scenes I see in Germany, they're much more, let's say, there's a polyvalent drug use of all kinds of drugs. Yeah. There's no longer the heroin culture because it's very expensive. People take all sorts of drugs meanwhile. I would say there's the pure heroin user is a exception. People take substitution drugs, they take alcohol, they take benzodiazepines, they take crack, they take methamphetamines. The drug scenes are no longer split apart. It's in the big cities, one drug scene's taking all kinds of drugs. And so far, this is a big myth in a way. The children from the station Bahnhof Zoo. I don't know the English title exactly, but thanks for the introduction.
I was surprised to find out that the book is over 40 years old from publishing. It's like 43 years old, okay. 1978.
But it's still obligatory reading in most Czech schools.
It's still obligatory reading. And at my memories when I was growing up in the 90s after the Velvet Revolution, that it was the kind of scared tactic and on many debates and kids really, the impression I got from it and from the whole debate in the 90s here was, you basically, drugs are something and you take one puff of joint and in a week you're hooked on heroin.
Yeah. And
then I see like 30 years from that time, I see a huge shift, which is the debate is completely different. So where I was aiming is that this is kind of, maybe it's it's oversimplified and it's kind of caricature of what really went on, but it served as some kind of explosion, putting the topic on the table, and it allowed those past 30 years and maybe more in Germany, obviously, to kind of rationalize the debate and come from total not understanding and repression to a very nuanced debate on how to deal with the problem, which is not going away, which was then the idea, we'll get rid of it, it will just disappear.
Yeah, you're absolutely right. Now that we talk about it, I realize that the book is that old. My daughter, which grew up in the 80s, she read the book several times, and I was a little bit worried what's happening here. But I was a little bit scared if she's in sort of a drug culture in any way, but nothing happened. But you're absolutely right. The whole perception of drug use, heroin use, was a little bit mystified and also emotionalized, associated with that book and with that culture and with David Bowie as the star around it. It has a little bit sort of a mystified thing. And you're absolutely right, we're talking now in a different way. Christiane F still is alive in Germany. She's still in substitution treatment.
Okay.
She does not have a significant role at the moment, but everybody knows it. From time to time she's in talk shows, whatever. But you're absolutely right, the way of how we talk about drugs changed completely. Now we are talking with much more evidence. The drug debate is emotionalized, of course, because everybody's scared. Parents are scared. People are scared what might come out of it. But I think we do have much more evidence now of what works, what should we do in terms of politics, practice, and so on. So I think we are quite in a good way to talk about drugs in a better way, in a more scientifically led way. And I think it's good for the debate and for the people who are hooked on heroin or who are dependent on drugs.
Mm-hmm. And because Germany is seen as a good example of a rational discussion on substance abuse, I think Europe-wide, as well as the Czech Republic. Do you agree with that, or because you nudged a bit?
I wouldn't agree with that. I mean, basically, we are on a good way to talk more, let's say, with more evidence. But also Germany, we have a north-south gap, we have an east-west gap due to the unification. I think these gaps need to be mentioned. So they're also religiously led from north to south. They are to be explained in a political way from west to east, of course, with the results of the reunification. It depends a little bit. So there are regions where we can talk about that quite liberally. And in a way that is oriented towards how to do best, which evidence do we have, what should we do? And in some parts of Germany, still religion is quite widespread and has a say. For instance, in the north, religion does not play a role at all. In the south, we have a huge Catholic region where church does have a say still. And these factors, of course, contribute to a certain way of the discussion. And how do we perceive drug discussion?
And isn't it this, with this logic, Germany the perfect example for the basically whole Europe, because it is incorporating all the differences, the division between more religious regions, less or like atheist regions, as well incorporating in one nation after reunification, basically East and West. So it's like one nation that has different settings all around.
Yeah, you're right. I think once you're abroad for a long time and come back to Germany, you see it is it my country? Because you feel a little bit of lack of identity for the whole. It's very much, it's a federal state. We've got 16, for instance, I'm working very much in the prison system. We've got 16 ministries of justice, 17 to be honest, one federal. So it's very diverse and heterogeneous. That's indeed true, and depends very much on the region, on the political flavor, on the political, let's say, color where you're working in. And so are the states. They are very, very diverse, I would say, from north to south and from east to west.
Do you think it would make any sense to, in EU dimension, to try to find some unified policy towards addictions and drugs, or is it better to just let those who are more progressive to go forward and those who still are in the dream of complete prohibition and complete drug-free society to stay where they are?
Yeah, I think generally, and that is the explanation for the success of Angela Merkel, generally there is, let's say, a certain way of thinking to be German. But on the, Angela Merkel is the successor of that. But let's say in terms of a specific policy, there's a concurrence among the states. And that might be one reason for the success economically of Germany, that the states are in concurrence with each other. They have a huge, let's say, power to do things this way or that way, a huge autonomy. And also this is true in terms of politics. They're always the same states going ahead with certain innovations, no matter economically or politically, the same suspects always do first, and then others come along with the gap of 10, 15 years sometimes. So, and also in drug policy, we do have, let's say, the innovative character in the north, basically, and the southern states come along, some years later. Although there are some, let's say, German or nationwide innovations, but in how far it has been interpreted and how far it has been implemented, that, of course, then is again regional policy. One good example is the heroin-assisted treatment. Some 1,200 opioid-dependent people in Germany receive medically controlled and supervised intake of heroin, diacetylmorphine, and the way of how it is implemented is dependent then on the region, on the state. So the usual suspects do it that way, and the others come along 10 years later. Another good example is drug consumption rooms. We have a national law for that, for the implementation, but it depends if the states have a law allowing the drug services to implement such a drug consumption room. And out of the 16 states, only 8 states have such a law. That means only in 8 states it is allowed to implement drug consumption rooms where you can smoke your heroin or inject your heroin, your cocaine, your crack, whatever. And the other 8, it's a very good example because it's splitting apart Germany. The other 8 are not interested in doing that, despite they have huge numbers of drug-related deaths, for instance, like Bavaria. And Bavaria is the usual suspect of being a little bit
conservative approach
in innovating things. Bavaria does have high numbers of drug-related deaths in Munich, Augsburg, Nuremberg, Regensburg, and all of these cities, but does not allow the drug services to implement drug consumption rooms, which are a good, not a guarantee, but a good measure to reduce the number of drug-related deaths. Yeah.
Mm-hmm. And if you look outside of Germany, around Europe, which country would be your role model and of a systematic and quite liberal and harm-reducing approach.
Yeah, there are very good role models, I think, in Switzerland. Again, Switzerland is a federal state with 26 cantons, I think, even. But I think in most of the states of the cantons, quite a liberal drug policy and a scientifically led or scientific-oriented drug policy is going to happen. And I think Switzerland was the role model for many of the German innovations. We just simply copied the politics. That is true for drug consumption rooms, heroin-assisted treatment, for gender-specific approaches in drug policies, for street work with drug users, also for, let's say, legal options. In Switzerland now, the possession of up to 10 grams is no longer punishable in a way that we have in Germany, or is it not a criminal offense anymore? It's a misdemeanor. It's just like wrong parking. So for up to 10 grams, you will get a fine, and then it's gone. So you will not have like in Germany for a milligram or 1 gram, you can go to court in some parts of Germany. Not in the north, but in the south for sure. And that's a good way, I think, a very liberal way. Why should we punish people having drugs in their pocket for their own consumption?
Yeah.
Okay. Is the policy towards drugs and addictions something that should concern European Commission? I see in the papers that you consulted for EC as well. So do you think it is realistic to expect something, some contribution from EC?
Yeah, for sure. The European Commission, they do have an action plan. They do have a strategy plan, and that is very much evidence-based, coming from the European Monitoring Center for Drugs and Drug Addiction in Lisbon. They are the ones who get together all the data and collecting from each and every member state the developments and the most recent data. They pool them and they make some conclusions out of the developments, and that is feeding the European Commission policy on drugs, and that is very good because there's no extra policy, let's say, developed out of the pocket from the European Commission. It's data-led. It's based on the most recent development, and the EMCDA in Lisbon, the European Monitoring Center for Drugs and Drug Addiction. They are led scientifically, so there's a lot of evidence in the European drug policy. And for sure, the different role models, for instance, in the Netherlands, in Switzerland, although not member of the European unit, the European Commission, or Spain and Lisbon, or Portugal with a new drug policy, they can be role model, and they are highlighted by the European Commission. And the politics of our neighbors is very much debated in Germany. So we point out to Spain, to Switzerland, to Holland, why is it not applied here? Because, for instance, the drug policy in Portugal is certainly very successful. Not to put people to the prison, but to say, look, you might have a health problem with drugs. Go to a counseling center, go to a treatment center for your drug problem. Obviously, you have a drug problem, but we as police, we will not take you to the arrest cell, and we will not take you to prison for the amounts you have in your pocket. And I think this is the future drug policy.
Do you see, because in some of the initiatives of European initiatives like Beating Cancer Plan, there is still a bit of an approach that's saying that is viewing all possible vices, even drug addictions, as something to get rid of. So it's a little bit maybe not realistic in acknowledging what's happening in Germany, even in Czech Republic, that it is a part of life, basically not possible to eradicate, only to somehow manage the damage and the trouble.
Yeah.
Do you counter that?
Yes, I think you mentioned the European Beating Cancer Plan. This is a good example to get Europe tobacco-free in 2040, which is a little bit unrealistic, to be honest. We have the same plan, by the way, in Germany, to get Germany tobacco-free in 2040 as well. That we will have only 5% of smokers in 2040. This is unrealistic. We now have a prevalence rate of 28% of the adult population is smoking. 28%. It's quite high compared to our other European countries. In 2030, the government wishes to go down to 19% of smokers. Again, unrealistic. It is unrealistic because it's a wishful thinking. Yeah. If we do not have, let's say, the evidence-based plans of how we can achieve these goals, then it will stay unrealistic until 2040. I think we have to include harm reduction approaches to go to these goals until 2040. And that means we have to utilize the new approaches, especially in stop smoking strategies and stop smoking policies, and that should include e-cigarettes, tobacco heater, nicotine pouches, and these are, let's say, harm reduction measures. Yeah. And we know from other parts of health policy that harm reduction is a valuable tool, a valuable strategy to quit also vaping at a certain point of time. But vaping might be an interim solution for many people to get rid of tobacco smoking, to combustible cigarettes, away to vaping, and from vaping, of course, to abstinence. That could be a scenario for many people. But with the traditional means of quit or die, we go for abstinence, and there's no goal in between abstinence or addiction. Yeah. That is completely unrealistic. Also with cannabis, with heroin, with methylamphetamine, we do have these harm reduction interim solutions. And that is good for many people, that people are on methadone, they wouldn't use heroin anymore. Methadone is a harm reduction measure. And I think we have to go this way.
Why do you think that there are still quite a few highly influential people, let's say in EC, who believe, even if they have evidence-based data that says that prohibition approach doesn't work, and it doesn't work, obviously, in heroin, methamphetamine, etc. Yet they still try to apply this approach towards tobacco. Let me cite Despina Spanu, head of cabinet of vice president of the European Commission, who said, "The ambitious aim is for a tobacco-free Europe. Frankly, tobacco doesn't make sense to me. It is an addiction, and it needs to be fought with a hardline approach." Yeah. Why is that?
It's a good quotation, and it shows very the way of how wishful thinking is functioning. We all want a tobacco-free Europe. For sure. But we have to realize some people take tobacco just for pleasure. And in this quotation, pleasure does not play a role at all. But pleasure is, of course, something for mankind, a very valuable way of, a very valuable phenomenon, like sex or good food or drinking or whatever. Pleasure is part of our life. And we cannot just ignore the pleasure seeking of people. It's one way how they express the quality of life. When I stopped smoking 37 years ago, I felt really a loss of life quality, quality of life. My wife never realized, she never smoked a single cigarette. I was up to 20, but I lost a quality of life. And that is, of course, something I think an example for many people. To stop smoking is a very severe loss of quality of life. And we have to deal with that. What can we offer people? We can offer people abstinence. Okay, abstinence is good. You can jump up the stairs much more. You can save money. okay, these goals are valid for some people, but not for all. Some people go for these goals. They stop smoking because they can save money. But for many people, this is not, let's say, a temptation to quit smoking. We have to offer them either other devices like e-cigarettes. They can vape. They have something orally, something haptical between their fingers. Yeah. They can inhale something in their lungs. It also has an olfactoric notion in a way. That's something as as a substitute. It can go for a few months, for weeks, for years, I don't know, until people get off of these devices as well. So we have to, let's say, deal with pleasure and substitutes for pleasure. What can we offer? So I think this is the way of how people are functioning, of how people can be tempted to consider cessation of smoking.
And how do you view, because I see this hardline approach, but as well in the past few years, I see a totally new debate taking place globally in alternative platforms, a lot of podcasts, where drugs are in a way portrayed or talked about in a positive connotation in regard to treating mental illness with psychedelics, a lot of health benefits of CBD or marijuana, a lot of even there's like a new trend of microdosing, for example, LSD, with a lot of people saying it helps us perform way better, and that's something taking. Gaining pace a lot of people talking about, probably even doing it, and it's a completely different sphere than where this kind of regulation talk is at. So do you see that this kind of splitting difference between what is really going on in a public debate and public behavior and the regulation or legislation debate?
Yes, it is indeed splitting apart. We, on the one hand, see with your quotation, let's say, a mystification of abstinence. Abstinence is good. It's a fantastic, sexy goal. It has a sense of purity, and we all like purity. Being a part of any drug is a fantastic goal, and but the reality is different. Almost 95% of German people and European people are drinking alcohol. There are a few elderly people who are doing not, and some babies are not drinking alcohol, of course. So the reality is different. But also changing. For instance, in Germany, the age group between 12 and 17, only 7%, it's a coincidence that's the same number, only 7% would say, I have had alcohol use last week, or I smoked last week. Only 7%. So the huge majority is not taking these drugs anymore. So it's an old school model. So they don't like alcohol anymore. Yeah. We have to see whether this is, let's say, something which is going on in their third decade as well, which can be maintained. We don't know yet, but it's surprising that these drugs are no longer, let's say, attractive. Attractive is cannabis, and the numbers are growing a little bit, but cannabis obviously is here to stay. In Germany, and I think in Czech Republic as well, it's unrealistic. We cannot think of a cannabis-free Germany or Czech Republic. Obviously, it's there to stay besides alcohol and tobacco and coffee and whatever. And let me say a last word on your of your perception. what I perceive is a diversification of drugs. So we do have much more drugs than 30 or 40 years ago. We do have in Germany, not in the Czech Republic, methylamphetamine, pervitin. We do have cocaine. We do have crack since the late 80s or middle 80s. The cocaine for the poor people, as it is methylamphetamine as well in some way. So the range, the palette of drugs has become wider since 30 or 40 years. So we have cocaine powder as part of certain parts of the society, those who can afford cocaine. We've got, we would call it Mediterranean drinking habits. People drink on a daily basis. 40 years ago, alcohol has been used only on certain feast days, on the weekend probably, on birthdays, anniversary, whatever. But now people tend to drink in a Mediterranean style.
Lunch, dinner, and
for lunch, for dinner, wine is being offered, we drink in this Mediterranean style, despite we have not come closer to the Mediterranean Sea. But we're drinking that way. We're drinking less in a way, but on a continuous basis for several people. And especially for, let's say, for some parts of the society, for instance, women in leading positions, the alcohol consumption has risen quite a lot. So we think that alcohol is part of the way of how we can compensate stress, pressure, and so on. And in this way, alcohol still does play a major role in Germany, I would say. We are in an economic way, we are very successful. The economy is running. And I think alcohol is one way of compensating stress and pressure of this way of economy.
I cannot miss opportunity to ask my favorite question. You mentioned partial decriminalization of drugs. Well, what do you think that would happen if there was absolute decriminalization? What do you think that would happen if, let's say, heroin could be bought at state-regulated specialized stores, pharmacies, and tax it, etc.? But if it was made legal, do you think that the number of people using drugs would rise significantly or not?
I don't think so. I think it would not, let's say, rise completely or in a scaring number. Take the example of cannabis. You can buy cannabis each and everywhere in all the German cities and in most of the European cities. So people would approach you, not me, I'm 66, but at any, let's say, tram station, people would come up to, let's say, people in the same age and ask, do you want to buy cannabis? It is being bought despite it is illegal, despite you can be criminalized in a severe way in some parts of Germany. For 3 grams, you can be put to court, and for 20 or 50 grams, you can go to prison even. But it is not, despite this deterrence, it is being used on a daily basis in many parts of Germany, in many parts of the society. And I don't think it would explode. Those who like cannabis, who prefer cannabis, do buy cannabis despite it is illegal. And the same with opioids. I think I cannot imagine buying freely opiates in pharmacies. I think this will be a very, very severe change in the whole drug policy. Although it might be not unrealistic, we could buy, for instance, methamphetamine until 1988 in pharmacies in East Germany. In the GDR, you could buy pervitin. If you have to have a huge work on the weekend, you have to write your bachelor or your thesis, whatever, people would buy Pervitin, for instance, in the pharmacy. But there was no big Pervitin problem in the German Democratic Republic at that time. So we have to,
I guess it's worse now when it's produced in Czech border regions and then imported illegally to Germany.
It is now worse than ever. It is being produced in any garage, in any kitchen, whatever, with the unknown quality. I think it would be better to buy methamphetamine in a pharmacy, for sure. That's quite clear. Not missing to inform people, to educate people on the dangers of taking Pervitin, let's say, for a long time. But if people want to buy it for what purpose soever, on a discontinuity, on a basis of discontinuity, I think it's the best to buy it in a pharmacy and not buy it on a tram station or on a main station in Frankfurt. That's for sure. And the
possibly contaminated with
exactly. We've had cannabis contaminated with a word I don't know in English, Blei. Wojtek. It's a heavy metal.
Oliver? No.
What's it again? Plumbum.
Yeah,
exactly.
Yeah.
So it has
lead.
Exactly.
Lead, yeah.
It has been contaminated with that. We do have severe contaminations of the street bought heroin with very severe contamination products. So it would be better to treat heroin addicts with pure heroin. We do that, but only for a minority, 1,200 people. We do have a tenfold more people hooked on heroin, addicted to heroin, or even 15 times higher. But we make the treatment very high level. We do not do it in a way that many people can benefit from that, because you have to go there 3 times a day, and many people don't want to show up or cannot afford to go 3 times a day, or simply cannot make it because they are scared to go there, and they're not in that case. So my answer to your question is yes, please let us think about models and a varying, heterogeneous model of, let's say, access to drugs. I would go for cannabis in certain special shops, for instance, where also we can inform and educate people. We can go for certain drugs available in pharmacies. And we can go for drugs only on prescription, for sure.
Do you think there's a little bit of detachment of politicians, and especially politicians in Brussels, because even in the Czech Republic, there's an ongoing debate on how to deal with cannabis, like legalization, stuff like that, medical cannabis. And when I talk to politicians, they always say, it's a very controversial topic, and even cannabis, that can, it will be fine. And I'm saying, if you go, the different story would be 30 years ago in the 90s, but today you go into small villages away from Prague, and even as a country with the highest consumption of beer per capita in the whole world, beer is no discussion. That's not controversial. But every Friday, in front of every local pub, people smoke cannabis. It's something they lived with. Older people make potions for their health problems, and they grow it in their gardens.
And
sometimes
technically they are criminals.
Technically they are criminals. Sometimes even in reality, when some neighbor
persecuted,
we have cases of 80-year-old grandma being prosecuted for a few flowers of cannabis. So I see there is a lot of detachment from people that kind of take it as a part of life, and I drink beer and then I smoke a joint, and then politicians who approach it as a problem that is, in their eyes, way more controversial than in reality.
Yeah.
Do you see that in even like German or pan-European debate?
Yes, I see it as a pan-European debate, and we've got different solutions in Europe, and we've got different solutions even in one country. So it's a very heterogeneously led topic, or the way how we deal with it is very heterogeneous. And we've got a variety of respondances to that. In Germany, we would say that north-south, east-west gaps, it's been tackled differently. We have got liberal regions and very tough regions where we can go, where you can be put to court for a few grams. And I think this is the example for the whole of Europe. We've got some countries with very innovative approaches, which are being discussed in our country as well. For instance, the Portuguese model, where you can have, let's say, for personal consumption, clearly marked quantities in your pocket. That's one model, the most, I think, attractive model for Germany. Then we have this model of cannabis policy in Holland, where you can buy legally 6 grams of cannabis in shops, but the production is still illegal. So it's a very controversial and a very, let's say, a model which will not be applied in Germany. So we would look for a whole model from production to dissemination and distribution. And we have the model of cannabis possession as misdemeanor in Switzerland, but also there's a new legal approach to be discussed in the next year. Hopefully it will come true in Switzerland. So there's a whole variety. At the moment, the official answer to cannabis use is it's the same as heroin. We have to punish it. We want a cannabis-free Germany. We want a cannabis-free Europe. But that, the same with tobacco, is unrealistic. But people do it. And for instance, the drug commissioner in Germany, which is from an ultra conservative party, she is announcing that cannabis-free Germany, and people start laughing about her. So it's no longer realistic. Cannabis is here to stay also for the next 50 years, and we have to deal with that in a very intelligent a very intelligent way of controlling it, and no longer debating unrealistic solutions.
Do you see a huge influence of American debate, or what's actually happening in America? And you have, some of the southern state going basically full liberal mode, legalizing, putting special shops, and already we have quite a lot of time that there can be a lot of evaluation about this model, and it seems there's no hugely negative impact. So does this affect the European debate, or are we kind of focused on that this is how we do it? And
I think we're a little bit focused on Europe. So if we've got good role models in Europe, we would, I think, focus on that. America and also Canada is quite far away. Some people point on Uruguay with the state licensed model, where cannabis is being produced and distributed under state supervision. That's far away. Also, America is not, let's say, a role model. The prevalence of cannabis smoking is much higher in the US than in Europe, especially the West Coast, which have been, let's say, starting with the legalization of cannabis at first. Not, of course, the East, not the Middle West, but the West Coast states. And I think a little bit the model of Canada is being utilized in our discussion, because cannabis, Canada.
Cannabis.
Sorry for that. Canada does have a very good public health approach to that. They're not simply selling cannabis, they're undertaking huge preventive measures to put it in the right way, to educate people, to inform people. And that could serve as a role model. At least we discuss it. But I think the way Portugal is dealing with the problem, have something in the pocket, is an interim step. towards, let's say, the full legalization from production to dissemination and distribution. And I think, the Portuguese model is the most the highly debated model.
You mentioned quite a few times the words harm reduction, and I think in Czech Republic it's a big topic on harm reduction on tobacco use and using of alternative products like e-cigarettes and heated tobacco, etc. Do you think that in Germany these products have sufficient support from the government, or is it viewed as something that should be supported in trying to reduce the harms?
No, harm reduction in terms or with regard to tobacco is not a topic at all. So it's a minority approach who says, we should do harm reduction in the tobacco field as well. And I'm a supporter of that position. But let's say the official policy and politics doesn't play a role at all. Differently to UK, where tobacco heat or e-cigarettes, let's say alternatives to combustible cigarettes is a big issue, also supported from the government. This is not the case in Germany at all. And also in the German public, some 60% due to a recent interrogation, some 60% believe of the German population that these alternative products are as or even more dangerous than combustible cigarettes. And this is the result of a disinformation campaign, I would say, from the German health agencies. They did not educate and inform people at all. In the opposite, they said exactly that. Combustible cigarettes, alternatives to combustible cigarettes are as or even more dangerous than cigarettes. And that has resulted in this strange perception of the new devices. I'm an absolutely supporter saying that vaping is less dangerous than smoking, than using combustible cigarettes. The UK government, the Ministry of Health in the UK says it. For those people who have tried several times various strategies of quit smoking, they should think about, should consider these new devices, these new products of nicotine intake. If they are dependent on nicotine, they have tried unsuccessfully several times to quit smoking, they should consider this alternative. And I'm strongly support this idea because, vaping is, according to scientific data, 95% less dangerous for healthy people. Not, let's say, for people who have COPD or have any lung cancer, whatever, or any other form of cancer, of course. But for healthy people, it is up to 95% less dangerous.
If you look into the future, do you see the way we go forward in Europe as some kind of bottom-up approach? So more or less competition of different models, and you'll see, because we have the data, you'll be able to compare them, see advantages, and slowly and naturally influencing each other and finding some common solutions? Or do you see it more of maybe as in this area as something of a Green Deal, that there should be like a European-wide solution and coming up, we want to hit these targets in 10 years and 20 years and pushing up from the center to the states towards? Or should that model be somewhere in between, like bottom up and some kind of coordination?
Yeah. Yeah, very interesting question. Thank you very much. I would go for both, bottom up and top down. Bottom up, this is the attractiveness of Europe, I think. It's United States of Europe in terms of that. It's very much fed by the regional or local experiences and innovations. We can learn from each other, and we do so. We learn from other European states that it is better, let's say, to provide clean syringes in prisons for those who are heroin dependent and injectors. That is being done in Spain, in all of the prisons. In Germany, only in 1 out of 180 prisons. But we take these examples in our argumentations, of course. So it's bottom up. We look very much at innovations in Europe, in the drug policy and the drug services and so on. But also, as we mentioned in the beginning of our talk, we need some European-wide information and politics. And if this politic, like the drug policy of the European Union, the European Commission, if this policy is scientifically fed and led, it is the best example, of course. And we do have these mechanisms. We do take the data from the European Monitoring Center for Drugs and Drug Addiction in Lisbon and feed our European drug policy with that. And I think this is the best we can do. And so it's top down and bottom up.
Okay. Well, why do you think that drug policies, I think in whole Europe, are so much riddled with those emotions and prejudices, etc.? I think that in healthcare you have evidence-based medicine, and when you have oncology patient, you don't try to treat him the same way how you would treat him 40 years ago.
Yeah.
You have new evidence. You treat him the best way that is supported by evidence. But in drug policy, it's all about, well, I feel drugs are bad, we should try the prohibition. It works so well in so many cases.
Yeah. You're right. It's still, let's say, the debate is still emotionalized in a way. But regarding 40 years before, we started in the beginning, we are on a good way, I think. But it takes a long time, surprisingly long time. I think we could have been much further already 20 years ago. But still, emotions do play a major role in politics, in practice, on a local area, on a federal level. And this is not only the case with illicit drugs. Their emotions are going up quite severely. But it's also, let's say, the case with smoking and alcohol. The background is we're talking about pleasure. We're talking about, let's say, we're talking not about pain, but about pleasure. And this is always to do with emotions. What do we afford people to do? How can they manage their pleasure? What is the role of the state within that? Shall people seek their pleasure on their own? Can we support them once pleasure is going into pain and dependency? What is our role as drug service staff? So the whole debate is going around pleasure. And our task as professionals is to inform the state with scientific evidences, also to be careful in the language, no longer to talk about addicts, because addicts is very much stigmatized and discriminated in all parts of the world. The Russians talk about narcoman, and narcoman is, let's say, the utmost evil of society. And so we inform...
Well, we have the same...
We have the same expression here in Czech Republic.
Okay.
Yeah.
It's completely associated with stigma. And we have to inform the state policy, the government, not to use certain languages anymore, to talk about, let's say, as the WHO does, substance use disorder. And so we have to educate and inform the government and the whole public, because it's our task as professionals to be very specific on certain terms, certain language, and certain politics. But I think we are on a good way. I'm quite optimistic that we can change. We can in drug policies as well develop better alternatives, more intelligent control concepts for smoking, for alcohol, for cannabis, for heroin, as we do now. We can do better. That is the slogan, by the way, of the Green Party in Germany for the next elections. We can do better than we do. Yeah.
Okay. I was trying to formulate my last question, which would be, as somebody who has been like decades in the field and you've seen shifts in a positive way and surely shifts in a negative way, how you see the future, if you see it brightly and as you know, we can do better. But I guess you answered that you are quite optimistic.
Yes, I think it depends a little bit on the coalition we have after September elections in Germany, and it always depends on these coalitions. But I think even under social democratic and Christian democratic governance, conservative governance, we achieved quite something. Just take the law on cannabis as medicine. So we have it since 4 years. There are approximately 80,000 patients receiving now legal, pure cannabis. And Germany did not crash down at all. So we can serve, let's say, people who are dependent, who have a disease. This answer is quite clear. For people with a acknowledged disease, we can do things. We can do innovations. We can deliver heroin to opioid-dependent people. We can deliver as a pain management cannabis, and some 80 to 100,000. We think in 10 years we will have 400 to 500,000 people receiving cannabis for pain treatment or for any other disorders, anxiety, whatever. We have got 8 big indications at the moment for cannabis as medicine. And the more people receive legally or legal cannabis, pure medically controlled cannabis, the less it is possible to say for the rest who are taking cannabis for pleasure, no, you have to take cannabis from the black market. Yeah. It's not for you. We've got 2 kinds of cannabis. One for the people, the poor people who are ill and who need cannabis, and those who are seeking pleasure. And it's no longer debatable, no longer treatable this way. Yeah. We have also the debate, the good nicotine and the bad nicotine. It's pharmaceutically, it's the same nicotine. And we have the same producers for the nicotine badges and plasters. This is the good nicotine. You can buy it in the pharmacies. You pay a lot of money for it. And the pharmacist is happy once you buy it. And if you're dependent on that, it's even better for him. You come into the pharmacy on a daily basis, on a weekly basis, and buy your expensive cannabis badges. And in the liquid for tobacco heater or e-cigarettes, you buy the bad, the dangerous nicotine. Pharmaceutically, it's the same. Pharmaceutical companies are doing the same, and there we have the bad nicotine. And this is, let's say, people identify it more and more as sophisticated, and this is no way of doing evidence-based policy, of course.
Well, we have a very similar experience, maybe even funnier experience in Czech Republic. That in Czech Republic, if you are a patient with a specific diagnosis, you can be prescribed medical marijuana. But since it is so highly controlled, it is extremely expensive. So for many patients, it's completely unavailable because it's not covered by the public health insurance. So they are prescribed medical cannabis, yet they still grow or get much cheaper cannabis from neighbors or friends or family members. So it's really weird. So they obviously need it. They are prescribed, yet they are technically criminals for growing it on their own garden.
Well, you should do it, of course, in a way that it is being accepted and acknowledged. In Germany, you get a prescription. This is for free. It's just like any other pill the doctor is prescribing. And it's up to the doctor and you as a patient to negotiate whether cannabis could be an option for my pain management, for instance, or for my anxiety disorder. And if the doctor says, yes, we tried out many other things, did not help really, then let's go for cannabis and look after 2 or 3 months if it's working the way we are expecting it should work. And it's completely up to the doctors. We do not even in the law have a catalog of indications. So it can be prescribed theoretically for any disease.
Flu.
Like it was 100 years ago. It was cannabis has been taken in the German society for, let's say, pain of menstruation or warts, something like that, or hemorrhoids or whatever. You could buy it legally in pharmacies at the end of the 19th century still. So, or till the early 20th century. And now we are rediscovering the therapeutic potential of these substances. And I think so we can do for others as well. For opioids, which is a fantastic analgesicum, fantastic drug, off the protocol, of course. It's pharmacologically, it's a fantastic substance since thousands of years and is being used for certain analgesic purposes still now. And what other drug do we have that has such a rich career and such rich history? So we should make use of the therapeutic potentials and potencies of these substances. We would be stupid not to do it.
Yeah. I think that's the topic is opening in the Czech Republic in regards to. I think it's kind of experimental in like a national psychological health institute, and they start experimenting with some hallucinogens, treating mental illnesses and other states. Yeah. And I think it's being received quite
for 50 or 60 years.
It's like okay, we have data, and it's a global debate that could have way more interesting benefits than current legal medication, and why not try it?
Yeah.
For 50 or 60 years, it was complete taboo because drugs are bad and LSD is drugs, so that is bad. And now people are rediscovering the potential.
Yeah, if people are growing cannabis, even better. So associated with that is the knowledge about the plant and let's say the whole benefits you can get from this substance. And I combine that, of course, with big knowledge. It's a different way. You buy something at the main station in the tunnel, illicit substance. So the knowledge associated and let's say the tradition around the substance and the gardening, the growing from neighbors, the exchange of this substance. It's a social phenomenon, and we should not criminalize that. It's no way. It's not an intelligent way to punish people for that. We should, in the opposite, we should educate them that the substance has this and that benefits and this and that dangers, and that's it, I think.
Okay. And if you let me one last question, which is slightly stepping aside, but I read that you published on healthcare in prisons and healthcare for, let's say, socially marginalized people. So why do you think that it is something important, that it is something that the whole society should care about?
Yeah, I worked quite a lot in prison during my career. I've seen definitely more than 100 prisons. I also worked with a Czech expert, Tomáš Zabransky.
Mm-hmm. Yeah.
He died recently. A very sad thing. In Central Asia and in many parts of the world, we are sending people to prison not for, let's say, for a lack of healthcare delivery. People should not go out of the prison in a better or with a poorer health status than they got in in the opposite. We should use that or make use the prison sentence as a window of opportunity to get people, let's say, stabilized, to let's say deliver healthcare. Maybe they had not had access to in the community before, like drug users. They are on the streets, and we have that in prison. We should make use of this window of opportunity and deliver them a drug treatment, or should react on hepatitis C infections or HIV infections whatsoever. And I'm strongly supporting let's say the having the same quality, the same size of medical healthcare in prison than outside, and people benefit from them because prisoners are the community. They come from the community and they go back to the community. And if they are infecting, for instance, their partners, their families with an acquired HIV or hepatitis C in prison, then it's of course affecting public health, and we should not do that. We should also think of them as part of our community in a certain form of a closed setting, but only for a limited time, and we should use that time. And I've been also in Prague to the Praha prison. I forgot. Pankraz, exactly.
Yeah.
And there, for instance, we installed with the European support condom automats.
Mm-hmm. Okay.
Sex is happening among men in prison, for sure, for what reason soever, and it's better they're using condoms once they have, let's say, anal sex or whatever sex. And in this Pankraz prison, on the toilets, we installed these automats. A good example, we have fantastic data for that, and not only Tomasz Zabransky, but also other experts were involved in that project. Victor, for instance, I forgot Victor. I forgot the name, sorry about that.
Okay.
He was having, with his crew, with his team, they were doing Victor Mravchik,
Okay.
sorry. They were doing research in these Pankraz prisons, and the reason was, is there any sex happening? Would condoms, automat, would they be utilized? Yes, they are being utilized. And it's a good example how science and research could feed the local policies.
Thank you very much. We always try to end up on a positive note, which we actually did with the last couple of questions. So thank you very much for a long interview and deep insight.
Okay. Thank you.
Thank you.
It was a pleasure. Very, let's say, good talking to you. Thank you very much.
You.
Very interesting questions.